is, otherwise it is going to the YouTube. You can take it from there. Otherwise it is going to the YouTube. You can take it from there. Otherwise, so we are going to the general discussion. Okay. Afterwards, I will disconnect from the YouTube because this session is only for the regular students. So the general part is going to the YouTube, and afterwards I'll disconnect the YouTube and I will stick on to the regular students, those who are with me for the regular batch or crash course. Fine. The first thing is listening subtest. I'm going just a little faster. You will make some notes if you want. Okay, otherwise you can watch from the YouTube later. So the listening subtest. So the listening subtest is the first test in the OET examination. So what you are supposed to do is you have to be a little very careful because it is in the beginning. You'll be in a panic. You'll be confused. You don't know what to do. You will be in the beginning stage. So you'll have a lot of tension. Once you go into the exam, you'll be relieved of this tension. But until you start the listening test, you'll be in a tension. So don't fall into tension. Overcome this tension and be relaxed. Everything is in your hands if you're out of confusion, out of panic, out of tension. So be relaxed. So there are 3 parts in the OET listening subtest, A, B, and C. There are altogether 42 questions in the official OET, and the listening subtest lasts around 40 minutes, exactly 40, appropriately 40 minutes, not exactly, a little less or more, 40 minutes. And you hear each recording only once, and the recordings will not be repeated. So the recordings will not be repeated, so be careful. So you have to listen only once and you have to catch those. So that is the reason why I'm giving you this session, so that you will not miss anything. So what are the techniques, what are the strategies to approach so that you will not miss. Now we have seen some students, we miss those, we are not able to catch those words. That is the reason why I'm telling you this one. So you hear each recording once only. 3 separate parts in the listening test. Be prepared for the test today. So familiar with the format of each part. You should know what form it is, what style it is, what pattern it is. So if you know, you will be ready for that one. See, for example, if you know that the enemy is strong, you will try to escape from him. If you know that the enemy is weak, you will run against him. If you know that the other person is opposite you and he is equal to you, then you will try to strengthen yourself. So like that. So you should know how the question paper is. So based on that one, you will start. Part A will be easy, part B will be difficult, part C will be most difficult. So all the listening content is appropriate for healthcare professionals in all the 12 different professions. So it is equal. So it is not just for nurses, it is not just for doctors or somebody else, it is for every professional. Then next, the listening subtest does not require specialist knowledge in any particular healthcare field. So all the professionals can equally perform. There is no difference. The listening contest tests the candidate's level of English proficiency in healthcare specific, and many people think that it is related to medical knowledge. No, it is not medical knowledge, it is English knowledge. So how well you are able to understand English, how well you are able to comprehend English or digest English. So that is what is here. Now let us study the 3 parts of the listening subtest separately. There are 2 different consultations in part A. 2 different consultations, healthcare professional consultations. In each consultation, a healthcare professional is talking to the patient. So the particular patient will be there, and a particular scenario will be there, and a particular setting will be there, and a particular case will be there, a particular disease will be there, a particular type of solution will be there, and a specialist will be there to give specialist advice. So everything is perfect. In each consultation, there is one note completion activity. One note. There will be one note, and notes, you have to take notes, and some information is there in that notes, and you have to fill in that notes. You have to complete the notes with fill in the blanks. 12 fill in the blanks. 12 fill in the blanks. Only fill in the blanks, nothing else. Only fill in the blanks. Part A lasts around 10 minutes. So 10 minutes you have. And each consultation is around 5 minutes, not necessarily 5 minutes. Around 5 minutes means 4.5 minutes or 4 minutes or 6 minutes, 4 to 6 minutes you can say. Part A tests the ability to understand and record specific information about the patients. So you should know that here, specific information. What do you mean by specific information? I told you generic to specific. What do you mean by generic information? What do you mean by specific information? For example, generic information means leg. Specific information means the right leg. So what do you mean by generic? Generic means in general. For example, when you say leg, it may be right leg or left leg. This is general information, common for both the legs. But specific information, specific problem. What is the specific problem? So right knee replacement, right. So right knee replacement. So you understand, body part, the is compulsory. The right knee, the left knee, the right shoulder, the left shoulder. So what is a specific information? So don't write a general information, write specific information. Specific information is more important. For example, if a person gives a generic name as a medication, don't write a generic name, write a specific name. Both are given, so write specific name. So that is how it is important. Part A tests the ability to understand and record specific information, not a generic information. So, special information, specific, special, generic, general. So, he doesn't want a general information. If you say, patient, it's not patient, asthma patient. So, asthma patient is more specific. If you just say patient, it is not specific, it is generic. Patient may be any type of patient, but asthma patient is a person who is facing the problem with asthma. So that is called special information. Patient is general information, asthma is specific information. So you should know what information. Many people don't know that they have to write specific information. So that is very, very important. So that is what now somebody told. We are missing some information. What is that information? This is the information. So for example, she has told, for example, there is singular and plural problem. So I'm missing, yes. I'm missing, yes. So legs, both the legs. Okay. Left side. Okay. Left side. Okay, so what is this, left or right? So that is also important. Okay, now next one is part B. There are 6 different extracts from various situations at the workplace. There are 6 different extracts from various situations at the workplace. Now, for example, workplace means it may be different situation. Whatever workplace medical professionals belong to. It may be home, okay? Home is also a workplace, home visit, right? Home visit. Then next one, it may be a clinic, it may be a hospital, or it may be any other place related to work. Workplace, where the work is going on, that is workplace, okay? So, right. So, 6 different extracts will be there. Independent, individual, they do not have relationship with the others. Everything is a unique, every extract is a unique identity, has a unique identity. So don't get confused, right? In each extract, you hear healthcare professionals either talking to each other or to a patient. So here, now try to understand, healthcare professional will be there. He will be talking to another healthcare professional, or he is giving training to subordinates, or he is discussing with a patient, or he is providing information to the patient, or he is discussing regarding a review. Okay. So whatever it is related to healthcare professionals. Then next, activity. There is one multiple choice question to answer regarding each extract. One question will be there and the multiple choice answers. So you have only one answer is the right answer and the other two are wrong answers. So you have to select the most appropriate. Sometimes there may be two corrects. The most appropriate answer we say, that is the reason why. The most appropriate answer you have to write, tick. Part B lasts around 10 minutes. That means each one lasts around 1 minute, 30 seconds or something. So it's something like that, right? Next. So 1.5 minutes to 1 minute 40 seconds like that. So part B lasts around 10 minutes. Then next, these questions test the ability to understand everyday workplace interaction. How to understand, somebody is giving information, somebody is giving direction, somebody is giving suggestions or advice or training or information how to take care or the procedure to follow. So how are you able to follow these suggestions or guidelines or interaction or discussions or meetings or conversations? How are you going to follow these things? Are you able to comprehend? Are you going to understand? Or you are facing difficulty to understand? That means if you do not know English, you'll face problem. So because of that problem, working environment will be affected. So that is the reason why they test you. That's it. You hear 2 longer recordings in part C. So part C, 2 longer recordings. And each recording is either an interview or a workplace presentation. So interview, it may be an interview. So interviewing one person, or it may be a workplace presentation. Presentation means how things go on. So it is a presentation on a topic related to healthcare. So they will be explaining how to deal with some things or what to do, what and what not, all these things. So they will be speaking and you have to identify. There will be spoken paragraphs, not written paragraphs. These will be spoken paragraphs. Each paragraph will be distinct and separate, like compartmentalized, or you can say watertight compartments. Every topic, every subtopic is separate. And in each subtopic, there will be one question or something like that. If it's a big subtopic, you will have 2 questions also in the same. There are 6 multiple choice questions. So 6 subtopics will be there, 6 questions will be there. So how it will be differentiated? First one is, for example, definition. Second one is the treatment. Third one is management. Fourth one is drugs. Fifth one is review. Sixth one is exercise. Seventh one is diet. Ninth one is something else like that. So all six subtopics will be different, and every subtopic has one question like that. I'll show you all those things. Then, so here there are 6 multiple choice questions to answer about each recording. Then this part lasts around 15 minutes. 15 minutes. That means you can say 6 questions, 15 minutes. So 2.5 minutes each. 2.5 minutes each. So you can understand. So part C tests the ability to understand the speaker's ideas and experiences related to the topic. Is a in-depth knowledge. It's not what he is speaking, but why he is speaking. What is the reason? What is the cause? What is the result? What is his ambition? What is his goal? What is he intend? Why he is telling? What is he expecting? What is the main reason? So like this, you should be able to understand the in-depth understanding of the thoughts of the speaker, not what he is telling, but why he is telling. That's what you have to think. That's what you have to understand. Here, a lot of thinking goes, not what you listen, but after listening, why he is talking, you have to guess. Okay. From his experience, what he is trying to inform you, what is he trying to tell you? Okay. So it leads logical deduction, reasoning, inductive and deductive reasoning. So first one is totally different approach. Second one is a mix and match. Third one is logical deduction and inductive reasoning. First one totally on listening. Second one is a bit of listening and a bit of reasoning. Third one is complete reasoning, logical reasoning, logic. Why? That is important. Okay. Fine. The next one, before each recording, you hear information about the context and instructions about what you have to do. So instructions are equally important. So you have to follow the instructions very clearly. Now there will be printed directions also, not only listening, there will be printed direction also. These instructions, the information which is telling before the audio starts, the information will also be printed on your test paper. Okay, what he will tell you. Before each recording, you have time to read the questions. This is called pre-listening. Pre-listening, what did I tell you there? It is pre-listening. So this is the pre-listening stage. So the pre-listening stage, what do you mean by pre-listening stage? Pre-listening stage, he will tell you, now you have some time to look at the questions. What many people do is just they look at the questions. They don't read them. They don't study them. They just look at the questions and they just wait when the audio will start, when the audio will start. They will waste their time. They do not know what is right. So now a brief recap of all these points. Okay. I'm just posting you so that you can go through these things afterwards. So first one is the listening subtest by Grandmaster class. So now here, the listening subtest in the first test in the OET exam. So don't be in a panic situation. Starting in the beginning, everyone will be in a tension. Avoid that tension. Overcome that tension. That is what I tell you. Overcome tension. No tension at all. Nothing. Tension. With tension, you are not going to gain anything. So no need to worry at all. Right. Next, 3 parts. So part 1. Now part 1 will be the easiest. Part 1 will be the easiest. Part B will be difficult. Okay, you can say like this. Part A is difficult. Part B is more difficult. Part C is the most difficult. Part C is the most difficult. Why they are separated into 3 parts? Because all the 3 parts have different goals. Part A will focus on small things, specific things, specific information. Part A will focus on specific information. Part B will focus on the ability to understand, and part C will focus on the reasoning power. Why he is talking like this? What is the reason and what is he expecting? What is the result? Why? That is again why. So why is he? That is also a reason. Okay. What are the causes? What are the reasons? What are the factors? So what are the goals? What are the ambitions? What is the main purpose behind this? That is what he is expecting. Then next, The time limit, the time frame. The time frame is 40 minutes. Once 40 minutes is done, that is done forever. Right. So in this 40 minutes, you have no time. You cannot go back to the question. You cannot revisit the question because the question is already played and nothing you can understand. Nothing you can remember. Nothing, nothing, and nothing. So be very careful. So you hear each recording only once. So be very attentive. So what are the techniques that you have to apply here? So once I'm giving you the strategies to overcome this problem. What are the strategies to overcome this problem? So the strategies are: one, focus, attention, and concentration. These are called facts. So facts. I'm going to give you a new point here. I am going to give you a new point here. This is called facts. So, F-A-C-T-S, facts. What do you mean by facts here? The first one is focus. The second one is attention. This is an acronym. So, acronym means every letter has means one word. Every letter is equal to one word. Every letter represents one word. Then third one is concentration. Concentration. Then the fourth one is techniques. Techniques. Then the fifth one is strategies. So these are the 5 different things that you have to follow. So focus, attention, concentration, techniques, and strategies. These are the 5 things that you are supposed to implement. So how are you going to, if I don't want to miss any word, then what you have to do is you have to focus, you have to be attentive, you have to concentrate, and then you have to apply the techniques and you have to apply the strategies. Yes. Okay, fine. 1 second. Right. So we have these 5 different things we have noticed. Now, right. So I have told you, you hear each recording once only. The recordings will not be repeated. So care should be taken not to miss anything. In order to take care not to miss anything, you have to focus, you have to show attention, you have to pay concentration, you have to use the techniques, and you have to apply the strategies. Now, say for example, when you are in a train and there will be 10 people or 50 people talking, and there is a lot of noise, and the train wheels and the sounds, the wind breezing, every sort of disturbance will be there, but still you are able to listen to the person who is speaking to you because you have these 5 things. You are applying these 5 things. That is why you will not miss even a single word. That is what is called focus, attention, concentration, applying the techniques, and using the strategies. Don't miss, never miss. Then next. So, yeah. So next one is 3 separate parts in the listening test. Be prepared before the test day. Familiar is I am teaching you to make you familiar with the format of the test. What is the test asking you? If you do not know, it will be very difficult for you to understand. So first learn what the question is asking. I told you part A is asking specific information. Part A is asking specific information. Part C is asking in-depth knowledge. In-depth knowledge. How are you able to understand the words of the speaker? That's the difference. So different approaches for different types of questions. Next. All the listening content is appropriate for healthcare professionals in all the 12 different professions. All the listening content is appropriate for healthcare professionals in all the 12 different professions. Okay, so content is same, appropriate means equal or useful or similar pattern. Everything is fine. Everything is fine. It is not injustice to any particular professionals. For example, doctors, so taking doctors material and not useful for nurses, not like that. This material which is given is applicable for each and every professional. General information, remember that. So normal information, okay, which everyone can understand. That is how they will give you. So next, the listening subtester does not require specialist knowledge. It's a general knowledge. It's not specialist knowledge. It's general knowledge, but special information. Information is special, but knowledge of English is general. Don't think about English and other vocabulary. Vocabulary is specific, but information or knowledge is general. Information or knowledge is general. So the listening subtester does not require specialist knowledge. What do you mean by this? It's general knowledge. General knowledge. No, you don't need to be a doctor. You don't need to be a podiatrist. You don't need to be a physiotherapist. You don't need to be a nurse. You don't need to be any specific professional. Anyone can understand, even an ordinary human being, not even medical professional, they can understand. Like that information will be there. Even any person, even a 10th class student, even a +2 student, even a 5th class student can understand. That sort of information will be there. It's not specialist knowledge, it is general knowledge, common knowledge. To differentiate between right and left, to differentiate between upside and top and bottom, to differentiate between before and after, to differentiate between during, before and after, to differentiate between earlier and later. So these are the general information which anybody can understand. Before meals or after meals. Medication, before meals or during meals or after meals. So before, during and after. So you have to understand that one. That is very important. Left leg or right leg, left eye or right eye, left side or right side, front or back. So this sort of information is required. And if you don't understand this sort of information, that means you are not suitable to get even C grade. That is what it is. So it is very general knowledge, not specialist knowledge. That is what it is. No, anybody can understand this one. Like that it will be. So be careful. Don't get upset. It is very fine. So try, I'm explaining the sentences. So it is to make you understand easily. So it is not specialist knowledge, it is general knowledge. But information is special. Knowledge is general, but information is special. So leg is information is general, but right leg special information. Left or right, be clear. Don't confuse me. Pain in the leg. Which leg? Left or right? Sir, left leg. So clarity regarding general knowledge. So don't confuse between knowledge and information. Okay. Right. That is what I'm telling you. Right. Next. The listening content test the candidate's level of English language proficiency in a healthcare specific environment. How proficient you are, how excellent you are, how extraordinary you are, how mediocre you are, how underprivileged you are, or you don't have knowledge, sufficient knowledge, incapable. So that is what it is testing you. If you cannot understand, that means you are incapable to understand. Then how you will understand the patient when you become a nurse or a doctor? That is what it is testing you. So if you don't know English knowledge, how can you deal with English speaking people? That is the point. So candidates level of English language proficiency. Many people think that this is testing medical knowledge. No. The listening contest tests the content test the candidates level of English language proficiency. Proficiency means excellence, means appropriate usage, understanding, comprehension of the candidate in a healthcare specific environment or environment. Yes. Next. Now, I'm explaining deeper. First one, I gave you superficial level, and next one, I'm telling you the techniques and tips, how you have to use these techniques. Okay, techniques. These are techniques, and strategies are how you are going to use those techniques. Strategy is approach to use the technique. Okay, now let us study these three parts separately. Okay, fine. Right. Now there are part A. Part A, there are two different consultations. What do you mean by two different consultations? There is first consultation, there is second consultation. So 24 questions, that is more than half of the questions. 24 into 2 is 48, but there are only 42 questions. 6 questions are short. That means there are 6 questions more in part A, combined, which is singularly more than the combined total of both the part B and part C together. So they together are 18, but part A together is 24. And 12 questions in each consultation. 12 questions in each consultation. There are two different consultations here. Those two are separate. They are individual. So don't get confused. When first consultation is finished, forget out, wash your head out of it, and then go fresh to the new. Every room is a different one, so go fresh for that one. Don't spoil your mind with the first type. For example, I lost one question there, so you don't get panic and going. So fresh start. Then in each consultation, a healthcare professional is talking to the patient. Now here you have to understand who is the healthcare professional, who is the patient, what is the problem related to, why is he asking, is it before the problem coming, or is he during the problem, or is he talking after the treatment, or is he giving a review? What is the condition? What is the condition? Before a disease, or during the situation where he is being affected by the disease, or during the post disease stage, pre-disease stage, or while disease stage, or post disease stage, or is he giving a review? What exactly is this? So who is the consultant? Is he a physiotherapist? Is he a doctor? Is it a nurse? Is it a podiatrist? Or what exactly? Who exactly is the consultant? And what is the situation? Is he talking to a patient? Yes. What type of patient? Is the patient a young person, or is it a child, or is he an adult, or is it a patient's father or brother or mother or sister? So caregiver. So who, or a home nurse? Not just to a patient, maybe to somebody else also. Maybe chance may be there. We are not sure, but the chance more likely 99% it will be a patient, and maybe chances are there for a caregiver or a person who is taking care of the patient. Right. Now, we cannot rule out any option. So here, who is the patient? Is he a male or female patient? Young patient or adult patient, or immature patient, or an angry patient, or a patient, or a senior citizen? Okay, the situation now, the situation, where is the situation? Where is the situation happening? Is it at home, or is it the clinic, or is it in the surgery, or is it in the ward, or is it a consultation? So try to understand, it is consultation actually, but the doctor, the physiotherapist, the special person is there. Where it is, consultation may be at home also. The doctor will go and consult the patient. He will take fees and he goes. More fees and go to the patient's house also sometimes. So it doesn't mean that every time it is the doctor's room or chamber or whatever it is. Anything is possible here. So next one, don't rule out anything, any option, any possibility. That is what I tell you. You have to be ready for all different type of circumstances. Act according to situation. And then, is it a pre-disease giving a suggestion, or during after being diagnosed? Okay, signs and symptoms, or a diagnosis stage, or admitted stage, or treatment stage, or recuperating stage, or discharge stage, or review stage, or post-discharge stage. What exactly, which stage it is, that also you have to understand. So all these things are very, very important. Next one, in each consultation, there is one note completion activity. Now here in this one note, first one starting, he will talk about the patient, then his age and past history, then present medication, then any surgery is done, or follow-up action or tests. So all these things will be discussed. There may be different stages in the discussion. So note completion, there will be stages. First, he will talk about what is your name, how old are you, where do you live. Then he will ask signs and symptoms. What are the signs and symptoms? When did you first see this one? What is your family background? You can say what is the related. You have to be ready with all these things. Anything will come. And when you take the paper directly, you should divide it into 5 different parts or 4 different parts based on the bold letters. Yeah, based on the bold letters. I'm going deeper into the topic. I'm going deeper into the topic now. I'm going C deep. Okay, I'm going C deep. Now I'm taking you to the case notes. Yes, now here what you should do. What you should do here. Now see here, the case notes is here. I'm enlarging the size. I'm increasing the size. Okay, one. Now let me take only one page here. One page. Yeah, only that one page I'll take here, so that yeah. Now let us see here. Yeah. One second. Let me discuss. So I'm going deeper into the point, deeper, hitting the metal deep. Okay, super cooled or super burnt. So I want to ask you 1 or 2 things. Whom I can ask? Yeah, Rajya Lakshmi. Okay, Rajya Lakshmi is on duty. Sorry. Usha, unmute, please. Are you able? Is my audio clear?
Yes, sir.
Usha, is my audio clear?
Yes. Yes, sir.
No, voice not clear. Reena. Hello, Reena.
Yes, sir.
What
Hello,
happened?
yes, sir.
Why no sound?
Yes, sir.
Why no sound? Okay, message in the chat box. Message in the chat box, please. Anybody? Message in the chat box. Yes, Reena. Is my audio clear? Okay, is the video clear? Is the video clear? I'm going deeper into the ocean now. Deeper into the ocean. So everything is perfect. Yes, very good. Fine, and fine. Okay, right. Now I'm going deeper into the subject. Let me have some water. What is the water? Here. Yes. Yes. Okay, there are some comments. Let me see. Yeah, fine. Thank you. Right. Okay. I don't mind anybody, whether anybody is listening or not. I make myself happy. If I am happy, everyone can be happy. That's all. So if any problem is there, just message me on my WhatsApp so that I can see here on the other screen, because I don't. Right. Okay, fine. Now let us see here. Now, okay. Fine. Print a screen. Yes. This is already given. 14, 18. Yeah. Yes. There are 12 fill in the blanks. There are 12 fill in the blanks. Now I'm taking you to the notes. Okay. I'm going into a deeper level so you can see now. There are easily, you can see that these things are going to help you a lot. These things are going to attract you. These things are going to attract you. This is the patient. Okay. Okay. Now I'm going to give you a dark color. So you have to focus on these areas. Bold ones are very, very important. Okay. So now you see these are very, very important. I'm taking you to the techniques. When you take the paper, these are the things which you have to focus. Now we are going to skimming. We are going to skimming. Now let us see skimming. You hear a physiotherapist. Okay. Complete the notes with a short. You have now 30 seconds. The most important, the deadliest information is here. You have 30 seconds. This is the time frame. This is the danger zone. 30 seconds. Okay. 30 seconds, danger zone. Wantedly, I am darkening it. So, 30 seconds. 30 seconds. Now, this 30 seconds is very, very important. Mind you, sorry. This 30 seconds is very, very important. This 30 seconds is very, very. What are you going to do with 30 seconds? You hear a physiotherapist talking to a patient called raise hands. For questions 1 to 12, complete the notes with the word or short phrase that you hear. But before that, you now, presently means before. So that is the difference, now and after, and finally. Now, later, finally. Now, later, finally. Now let us see here, the pre-listening. So this is the pre-listening part. The pre-listening part. Yeah. Pre-listening part. This is the pre-listening. The pre-listening stage. I told you there are 3 stages. The pre-listening stage. The pre-listening stage. Be very careful here. There are 3 parts in this pre-listening stage. In the pre-listening stage, okay. So what are you going to do? You are going to see the headings. You are going to see the subheadings. You are going to see the headings and you are going to see the subheadings. Fine. So these are very, very essential. Okay. Pre-staging, pre-listening stage. The headings and subheadings. Now the headings and subheadings are very clear here. These are bold now. See here, these are bold. Patient, 18 months ago, 1 year ago, 6 months ago, last month. Now I am going to show you something very important. How do you understand? How do you identify? How do you understand? And how do you identify these things? I am going to show you something different now. Okay. Right. Okay. So now let us see here. Right. One second. Save. Yes. Part A. Extract 1. Okay. Part A, extract 1. Okay. Yes, now we got it. Okay. Now let us see. I was searching for this symbol. Sometimes, they will technically trouble us. 1 second. Okay. So here, I'm going to give you topmost selections now. Okay. Now, topmost selections. What are the most important things? Now, you have to notice. Okay. First thing what you have to do is, who is talking? So, a physiotherapist is talking. You have to know this one. A physiotherapist is talking. And then he is talking to a new patient, non-known patient. So he's a new patient or a known patient? Unknown patient. A new patient means unknown patient. So first time this is the first visit. Ray Sands is giving a first visit, not a revisit, not a review. So this is what you have to learn. A physiotherapist, new patient, unknown patient, known patient or unknown patient. So new patient means unknown patient. This is how, okay, or review means known patient. Now here Ray Sands, name of the patient is Ray Sands. So unknown case. So unknown case, he doesn't know the history. So definitely he will ask history. So that is why history is here. You see, this is history. This is history, past history. So you should know that this is past history. Now I am going to separate the things here for you. So this is it. That's very clear. This is the history, the past story. Yes. So that's it. So it's very clear. Now, first one is the history, because new patient, the doctor doesn't know about the past. So he will definitely ask about the past. That's very clear for you now. Next one is the words which talk about the past is ago. Ago. How do you know that this is past? Ago. 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 Now see here, I told you known to unknown. Now the information what the patient knows first, known things. Then these are unknown things, further treatment. Okay, further treatment. So like this, known to unknown, everything will be in a systematic manner, it will understand. And this is past and this is present, symptoms, signs and symptoms, present. Then this is future. Further means future. How do you know that this is future? Because he is telling further. So past, present and future. You should be able to identify where he is talking about past, where he is talking about present, where he is talking about future. If you understand these things, it will be very easy for you. It will be dead easy for you, dead easy. This is why students score 450, 460. Why? Because they are able to understand how the course of discussion is changing. So this is past and this is present. This is present. Okay. This is totally present. Okay. And this is future. This is future. So you should know what he is talking about. You should know what he is talking about. So past, so this is related to past. Okay. Yeah, this is related to past. This is related to present. And this is related to future. So one lecture is enough for you to understand. You no need to do 100 tests. One test, one explanation, one lecture. Perfectly you learn. That is enough, no need. So this is about past. This is about present. This is about future. Now try to understand here. Okay. Then occupation. This is about occupation, profession, job. The same words will not come. Work, job, occupation, vocation. Different names may be there. So initial treatment, management. So referrals. So further treatment. But previous diagnosis. This is previous. Previous means past. So now you know what is what. Previous means past. Okay, fine. So this is about, yes, everything. You can understand. You can understand. This is future. So that time, whatever. So further treatment. Further means future. Future, past, present, future. So what is, everything is given here. Okay. Future means later part. Later part. So initial, medial, final. Initial, medial, final. These things you have initially. Initially means in the beginning. Initially means in the beginning. Initial. See here. The word is here initial. Initial treatment, further treatment. Initial treatment means past treatment. Further treatment means later. Before, after. Before. Initial means before. You should be able to understand. That is what I am telling you. In the speaking, he will say before, after. But here he is writing initial, further. So first, later. First, next. Like that, he may change any type of word. That you have to be able to identify. Then only it will be easy for you. All right. So it may be any style. Right. Now moving faster. Yeah. Right. Now let us go. So headings gone, subheadings gone. This is what you have to see every time. Headings, subheadings. Headings, subheadings. So this is past, ago, last. Sorry, last, not a month, but ago. Okay. Ago. So let me say, take another one here. Last. Last means past. So identify these words. Okay. Next one. Okay, fine. Next one. Right. Now moving forward. Next one is next stage in pre-listening stage A. This is A, pre-listening stage A. Then pre-listening stage B. I told you already I am going deeper into the point. Pre-listening stage B. Now here you have to identify 5 different things. Number one is names. Number 2 is numbers. Number 3 is new vocabulary. Number 4 is difficult vocabulary. Number 5 is special phrases. These are very important. Names will give you 10% of the answers. Sorry, names will give you 50% of the answers. If you identify the names, you will get 50% of the answers. If you identify numbers, you will get 20% of the answers. New vocabulary 10%. Difficult vocabulary 10%. Special phrases 10%. So try to understand this, what I am showing you here. Right. Names 50%, numbers 20%, new vocabulary 10%, difficult vocabulary 10%, special phrases 10%. Now I am going to show you how to identify these things in the text. It will not take you much time. It is very easy to identify. It is very easy to identify. Okay, sorry, before this one, we have to give this one. Okay, this, yeah. Headings and subheadings. Fine. So we are coming to the part A, conclusion of the part A. We are approaching fast. Yes. Now, so this is it. Yeah. Yes. Okay. So now names. I'm going to explain you how you have to find out these things. This will be useful not only in part A, this will be useful in part B, part C also. So it's a common lecture for everything. But the strategies are for part A, but the techniques are for all. The techniques are for all. The stages are for all the parts. Part A, part B, part C. Stages are part A, part B, part C. Strategies are, yeah, for this part A. Now let us see here. How to identify? Okay, same things you will do, but a different approach. Okay, fine. Now, names and names. How are names important? We are going to discuss those things. Now, let us see. I'm taking you to the paragraph here. He said 30 seconds. I'm giving you here very clear picture now. I'm giving you very important points. 30 seconds. He told 30 seconds. This 30 seconds is pre-listening time. This 30 seconds is pre-listening time. So this is very, very important. This is time bound. How to save this time and how to manage this time, I am going to show you now. How to manage this time. Now let us see, 30 seconds means 30 seconds, 12 questions, 30 seconds, 12 questions, 30 seconds, 12 questions, 30 seconds, 12 questions. That means 12, 2.5 seconds for each question. Too much, too much, too much. Now, what you have to see is very important here. Now, let us see here. The first one is how much time you are going to take. Now, you have to notice these 5 things. You have to notice these things: names, numbers, new vocabulary, difficult vocabulary, special phrases. Names. Names will have capital letter. Names will have capital letters. See, this is a name, capital letters, underline, highlight or underline, anything you can do. Names, underline. Next one, names. Just to see names, anywhere names are there. NSAIDs, capital letters. See capital letters, underline or highlight. So capital letters, names will have capital letters. Names will have capital letters. Names will have capital letters. So very important. So then next one. Okay. Next. Only go through those things which are important with fill in the blanks. Don't leave other things. Leave other things. Leave other things. Leave other things. So this is a danger zone. So leave other things. These are not important. This is not needed. So exclude. Exclude this one, not important. So what will do? Red mark. What will do? Not important. Red mark. Not important. Avoid. Not important. Avoid. Don't touch this. Don't touch this. Don't touch this. Don't touch this. No need to touch this. Unnecessary. Don't put your finger everywhere. Don't put your finger everywhere. That is what it is. Now you are left with only 12 lines. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So 12 lines you are left. That's all. In these areas, you have to see which are important now. Now, pain, common. So pain is very important. Pain, location. Pain, description. Pain is already there. No need to write again here. So pain, fine. So pain, description. So now we know that this is related to pain. These two are related to pain. Pain, location and pain description. Pain, location and pain description. Location means body part. Description means quality. Quality of pain. So location, description. So these two words you are supposed to underline. These two words you are supposed to underline. Pain, location and pain description. And if you are very sharp enough, you need not write also anything. Okay. Location. If you are average, write down. Location means body part. Here body part. Name of the body part. Body part. Name will come. Name. So names. I already told you names. Names. First one is names. Names are very important. I told you names are very important. Either they will be there or you have to provide. If they are not there, you have to provide. If they are there, be happy. If they are not there, you have to provide. So names will help. Either if they are there or they are not there, they will help you. Names are very important. So immediately you will recall mind, body parts. So recall names. Recall. Okay. So remember the names. Revise the names. Okay. Right. So just names, of the body parts. Names of the body parts. They just come as a flash into your mind. Where is the pain? It comes into your mind immediately. Names of the body parts. Finished. So just keep there like that. Next one, pain described. Nature or quality of pain. Immediately the quality of pain, nature of pain, easy pain, difficult pain, moderate pain, mild pain, severe pain, troublesome pain, irritating pain, itching pain, excruciating pain, or different types of pains will come into your mind. Now what you have to do is, how many of you are going for the exam on the 18th of December? Raise your hand first, or say, write down, type your names, don't raise your hands. So test date right here, test date, this is for you. Test date first. Type the test date here. This session is for you. If you follow this, don't do 10 tests or 20 tests. One test you do like this, 18th December, very good. This test is for you. 18th December, this test is for you. Take holidays. Now I'm going to give you continuous lectures. 18th December, yes, this test is for you. This lecture is for you. Yes, the others, come on, fast. Prashanti, January 22, okay. This lecture is not for you. Okay, I'm kidding. Okay, what about the others? 18th December, I want more of 18th December. Yes, Anisha, 18th December, okay. There are 4 students, 18th December. Okay, fine, come on. Yes, that's good. So these students who have 18th December, don't take things lightly, which I'm telling you now. Take seriously. Because this question, this type of words will be used everywhere. Whatever I'm telling you, these are vocabulary related to this. Vocabulary. Names, difficult vocabulary. So names of the body parts. Names of the body parts are very important. Now I am telling you, okay, names of the body parts. Okay, pain located. Okay, I went to the second question directly. Okay, back injury sustained lifting something. Lifting. Okay. So pain injury sustained lifting. Okay, see here, lifting something. Lifting something. So now here, this is the first question. Pain injury sustained, lifting, this is gerund. Doing something, playing, lifting, all these things, these are called gerund. This is a gerund. Gerund means a noun, verbal noun. Gerund means while doing something, during doing something. So during an activity, gerund, during an activity here. Gerund is very important. So first question, I'm teaching you vocabulary now. Vocabulary is very important. If you do not know vocabulary, it will be very difficult. So lifting means doing an activity, doing something, doing an activity, while doing an activity, sustained while doing an activity, while doing an activity. While means, okay, while doing an activity. So here no question, so we can write here. While doing an activity. So doing something. Lifting means doing an activity. Activity means some activity, doing something. What? While lifting. Doing means playing football, lifting a box, lifting a heavy metal, lifting a heavy rod, lifting a heavy object, lifting something. So lifting what? Lifting a box, lifting something. Now I am going to activate your vocabulary. Be ready to activate your vocabulary, because these words which I am going to show you will be useful everywhere. Activation, vocabulary, activation. I am activating the vocabulary for you now. This back injury sustained, no need to listen to something here. No need to listen. Even before you listen, you know the answers. 90% of the answer you know. What you know? That it is a noun. You know that this is a noun. So guess, lifting something. This something, not lifting something or lifting somebody. Lifting a child, lifting a boy, lifting a girl, lifting a son, lifting a daughter, lifting a neighbor, okay, lifting a baby, anything, it may be, sorry, somebody. So I'm showing you here, it may be anything. Lifting a grandson, lifting a granddaughter, anything it may be. Don't think it will be only thing. It may be somebody or something. Lifting somebody or lifting somebody. Anything is possible. Nothing can be ruled out. Be ready for everything. Emergency action needed. Ready for all situations. You should be a military soldier. I am the commander and you are the soldier here. Now activate your vocabulary. What all you can think. Come on, activate your vocabulary and write it down there. Activate your vocabulary and write it down there. I'm activating here. I'm writing. It may be lifting a daughter. Lifting a baby. Okay. Lifting a son. Or lifting a child. Or lifting an infant. Now you know. Why an? Why a? Why an? Why a? So you understand. Guess, operate. Come on, start typing something. Start typing your words. What all will come you can think. Don't think. Yes, very good, Jyoti. Excellent. A heavy object. Very good. Wonderful. Come on, start. Activate. Be dynamic. Be dynamic. I'm making you ready for the exam. We are in a battle now. We are in a battle. Your mind should be very sharp. Come on, start activating your vocabulary. Please. Okay, box, not box, a box, Usha, a box. Very good. Come on, start. I'm correcting. Yes, very good. Come on, start. Come on, fast. We are going to get everything. Even before. Yeah, come on, fast. A cauldron. A table. Okay. A wooden box. Come on, right? A and you have to use a basket. Very good. A rod. Very good. A capital letter should not be there. Dimosase, it is in the middle of the sentence. How dare you write a capital letter? Please remove the capital letter and write again. Please. Make it a habit. Make it a habit. A should not be a capital letter at all. Let it go into your brain. That's a wonderful student. You are my soldier. Be ready. If I say duck down because the enemy is going to attack. An ice pack. Very good. Ice pack. So how do you have to write an ice pack? Ice pack, is it a hyphenated word? Suitcase. Okay. Is it a hyphenated word? Let us go. I will help you everywhere. I'll help you in everything. Don't worry. I'll help you everywhere. Ice pack is there, suitcase is there. Are they one word or hyphenated words or two words? What it is? That also I'll help you there. Come on, type. Think all the possible answers. I'm making you think now. This one test is enough. Any test you will be a winner. Challenge. Dare to challenge with me now. Okay. A vaccine carrier. Okay. Vaccine carrier is one word or not? Ice pack is one word or not? How should you write? Yeah, come on. Right, very good. You are activating your vocabulary. Come on, more of it. So Cambridge Dictionary. Yeah, now let us see. Ice pack. So ice pack is one word or two words? Okay, ice pack. Yeah, ice pack is a bag containing ice that is put on a part of it. So this is a noun. What is bag to make it cool? So it is separate word. Ice pack, two separate words. Very good. Ice pack is two separate words. That is called Cambridge Dictionary is telling you. Very good. Excellent. Cambridge Dictionary is telling you. Yes. Ice pack, two separate words. Okay. Next one. Yes. Next one is. Yeah. Next one is somebody has written Suitcase. Yeah. Suitcase. Suitcase is one word or two words. Let us see now. S-U-I-T-C-A-S-E. Yeah, suitcase is one word. Suitcase is one word. So you are not supposed to write two words. So that is a mistake. If you don't know this one, you will lose this mark. Don't think that OET will give you mark because you go. There are many people who say OET is not giving marks. OET is not giving marks. OET is not showing any injustice to anybody. Okay, suitcase is one word. How dare you write two words? That means you don't know. Suitcase is one word. See here, suitcase is one word. You're not supposed to write. So if this comes in, if you write the same spelling, what's the name of the candidate? Yes, no problem. Anybody. It is for everyone. So just to assure. Yeah. Yeah, here. Suitcase. Yes, Reena. It's one word. Suitcase is one word. You have to write like this. A suitcase. This is one word like that. Vaccine carrier. Vaccine carrier. Is it a hyphenated word? Check it out. Vaccine carrier. Hyphenated or one word or two words. Check it out. So I don't know whether it is there in the Cambridge Dictionary or not. Let us see that. If it is there, it is good. If it is not there, vaccine carrier. Vaccine carrier. Okay, it is not there here. So let us see in medical dictionary. Medical dictionary, I'll tell you, medical dictionary. Vaccine carrier. So see in the medical dictionary. Okay, then you'll get Tabler's medical dictionary. Here it is. Vaccine carrier. So medical dictionary, free dictionary, medical dictionary, Tabler's medical dictionary. Let us see here. Okay. So these are very important. You lose your mark otherwise. Sometimes they may give, sometimes they may not give. So, right. Then next one, A luggage bags, Usha. A luggage bag, not, okay. A luggage bag or luggage bags. A luggage bag or luggage bags, both are correct. So if it is plural, luggage bags. If it is singular, a luggage bag. Okay, fine, that's correct. So very good. So this is something you got here. Then next one. Right. Now let us go to the second question. Question number 2. Question number 2. Question 2. Question number 2. Question number 2 is here. Pain located in body parts. Body parts. Don't write generic name, write specific name. Pain located in body parts. But here the body parts may be leg. But specific information again, right or left. Okay. Right or left. And definite article is must. The is must. The is must. The is must. Okay. Diana, the right knee. The right knee or the left ankle. So like this. The lower back. Very good. Come on, write. Whatever you want to write. Write down. Or it may be plural also. Knees. In the knees. Plural also. It may be plural also. Located in the knees. Located in the legs. Located in the shoulders. Sorry, I did not write the for legs. The shoulders, the legs. So plural, the. Usha, left, T small letter, left small letter, correct. The left knee, small letters, no capital letters, please. Mosa said, the left shoulder, the left shoulder. Come on, write down whatever you want, whatever you feel, you can write there. Very good, your mind is activating. So when your mind is activated, Usha, T small letter, the left knee, T small letter. Okay, very good, very good. Mind is getting activated. Next, come on, fast. We are moving to the third question now. We are moving to the third question now. The third question is type of pain. Third question, question 3. Question Moving on to question number 3. Type of pain or the quality of pain. Quality of the pain. Come on, write down fast. Fast. Severe. Okay, mild, moderate. Write down whatever pains, whatever types of pains. Okay. Okay. Write down whatever you want to write down. Write down. Activate your vocabulary. Activate your terrible. Okay. Yeah, come on. Excruciating, severe. Come on, write down. Learn. Throbbing pain. Wonderful, Usha. Excruciating, Rina. Very good. Musase, very good. Terrible. Diana, very good. Yes. Come on, write more. Think about the words. You know the words. Even one person writes, all the others will make note down in your notebook. These will be useful. Yes, very good. Pricking pain, Diana, awesome. Shooting pain, awesome. Okay, yes. Pain described as, no need of pain. Anisha, no need of pain. Anisha, no need of pain, because already pain described as, only one word is needed. Again, if you write pain wrong, because pain described as, he is not asking 2 words, he is asking only 1 word here. Write again, shooting, that's all. Okay, shooting, 1 word you have to write. Come on, write it again. I want you to write 1 word only, please. Numbing, very good. Moderate, numbing. Anisha, I want to see your word. Shooting, only 1 word. Very good. That's a right, student. Excellent. Yes, coming. Crushing pain. Awesome. Crushing pain. Come on, get activated. Okay. The enemy is coming fast. Come on. You'll die otherwise. You have to fight your arrows. Shoot your arrows. I'm your commander. I'm telling you, get more weapons and put it. You will become a Bahubali. Come on, fast. Yes, you'll be a strong soldier. Okay. Right. Very good. Now we are moving to the 4th question. Here. Yeah, somebody has given another word, I think. Stabbing. Very good. Stabbing pain. Yes, that's wonderful. Another word here. Mentions inability to. Now this is to infinitive. It is to infinitive. To infinitive means incomplete action. To infinitive means, this is to infinitive. To infinitive means incomplete action. This refers to incomplete. I want to play, but did I play? I don't know. Incomplete action. Information. Insufficient information regarding the activity. Insufficient information. Insufficient information. That is what it is. Now see here. To infinite mentions inability to jump, inability to dance, inability to sleep, inability to swallow, inability to rotate, inability to lift, inability to walk, inability to run. Come on, fast action. Question number 4. Come on. Question number 4. Action. Question number 4. Question 4. Yes, question 4. Yes, I did not give this link to anybody. Please don't share this link to anybody. Please don't share this link to anybody. This is only to my students. Okay, fine. Yes, right. Inability to turn over, inability to lie down, inability to, very good, awesome. Inability to walk. Right. Come on. Inability to anything. Inability to swallow medication, inability to play football, inability to do homework. So, inability to bend the leg, inability, bent is wrong, Jyoti Thomas, bent is wrong. 2 will come with a V1. I'm sorry, to infinitive. What is infinitive? Infinitive is 2 plus, okay, 2 plus V1. V1 means first form of the verb. To V1, sorry, correct it. To bend forwards, or bend backwards. Okay, anything it may be there. Bend forwards, bend backwards, bend sidewards. Okay, turn left, turn right, anything it may be. To see what? To see distant objects. To work okay. To swim. Okay, to drive. Yes, very good. Some other words. Think about different style. Right. To get up is get up 2 words. Sorry. Get up 2 words. Raja Lakshmi. Get up 2 words, not 1 word. Get up 2 words. Come on, activate your vocabulary. Grip things. Very good. Very good. Grab tightly. To grab things tightly. To grab things tightly. Yes. To grab things tightly. Very good. I get because of you. Grip things. Grab things tightly. Very good. Turn over where? Maybe in bed. Turn over in bed maybe, or turn over, turn side, turn to one side. Oh, climb stairs, spelling mistake. Correct the spelling mistakes. S-T-A-I-R-S. Correct your spelling and rewrite. If possible, write 10 times afterwards in your notebook so that you will not do this mistake again. Come on. Follow my suggestion seriously. Okay, then next. Fixed charts. Yeah, very good. Take medication. Inability to take medication because of forgetfulness, maybe. Take medication because of forgetfulness. It is the frustration. Maybe it is right. Who knows? Maybe it is right. Take medications. Very good. That is one other answer. So like that, think reasonably. Make your mind activated. Okay. Be hyperactive. Don't be lazy. Think different options. Right. Next one is the 5th question. Question number 5. Okay. You do one favor for me. Idli తీసుకొనిరా నువ్వు కూడా తీసుకొచ్చు ఇడ్లీ కానీ దోశ కానీ ఎదురుగా పూరి ఉంటుంది ప్లేట్ పూరి ఎదురుగా టెంపుల్ ఉన్నది కదా అయ్యప్ప టెంపుల్ పక్కన పూరి 2 ప్లేట్లు పూరి ఇక్కడికి తీసుకురా అక్కడక్కడ తిరగాకు డోంట్ మూవ్ ఓకే నౌ క్లైంబ్ staircases or a staircase or staircases, singular or plural. Okay, fine. Now question number 5. Now let us see question number 5. Dash sensation. Adjective. This is an adjective. Sensation is a noun. So here you are going to use an adjective. Adjective means a describing word. Describing means as. Sensation as. What type of sensation? Irritating sensation, itching sensation, scorching sensation, painful sensation. Okay, what it is? Come on, think fast. Activate. Burning sensation, scorching sensation, painful sensation, whatever. Come on, fast. Okay. Sensation. What type of sensation? Tingling, painful, itching, scorching. Right. Mild sensation, moderate sensation, troubling sensation. Then whatever it is, you write. Think. Lack of sensation, lacking sensation. Okay, lacking sensation. Okay, lack of sensation, lacking sensation, no sensation, or something like that. It may be anything. Right. So come on. Anything else? So you have to think like that one. Think. Next one is question number. These words will be used. Okay, question number 6. Now let us see question number 6. General numbness. See here, general numbness in the affected area. Numbness, no sensation. So that is numbness means no sensation. Next one, 6th one, dash. What is the dash here? Now this dash is occupation. So what are the other words that you may hear? Question number 6, other words that you may hear. So this is occupation. What are the other words for occupation that you may hear there? So it may be job, it may be vocation, it may be profession. Okay, work, occupation, job, vocation, profession. You are like this, any word may be there. So what are the names of the vocations? Involves travel, some manual work. Come on. It may be salesman, according to maybe salesman. No, travel involves travel. Teacher doesn't involve travel, my dear. Manual work, no, teacher doesn't involve manual work. It is mental work. See what I'm doing? I'm sitting in a table and a chair, on a table, and sitting in front of a table. That's all. Yeah, driving. Okay, occupation is not a driver, my dear. Occupation is driving. Occupation is driving. Oh, driver is the name of the, okay, he is the driver, but the name of the profession is driving. Okay. Occupation you have to write. Event organization, yes. Okay. No capital letter, no capital letter. Nowhere you have to write capital letter. Okay. Only if it is a special name you have to write. Okay. Business manager or tour guide, yes. Laborer, very good. Laborer, there are two spellings for laborer. One is laborer with you, one is without you. Okay. So the one is British one. First one is the British one. Second one is American. Both are acceptable. Okay, fine. That's it. Remember that one. Tour guide, events organizer. Then what else? What else? A driver. Then tourist guide. Fine, like that. Salesman. Salesman. One word. Reena, write again. Write again. One word, not two words. A salesman. Write one word. Yes. Anything else? Anything else? Yeah, you can say. What is this? The people who sell life insurance policies, insurance agents, insurance agent maybe, okay, or agents, so like that, whatever it is. So what is the profession? So you have to write whatever is possible. Then you can say security guard, spelling mistake, Usha, spelling mistake, guard, spelling mistake, G-U-A-R-D. Rewrite with the correct spelling, please. Okay, security guard. Then you can say, military, policeman, okay, police, okay, like this. There are many people who travel, okay, and they do manual work. Okay, security guard, that's right. Next one, we'll go to the next. Yeah, this is the name of the profession. Name is very important. I told you, name of the profession. This is what you have to activate. So next time onwards, it will be very easy if these words come in the exam. Okay, name, right. Next one is right. So you can say research scholar, okay, agriculturist, research scholar, all this may be possible. Okay, business, okay, fine. Right, next one is application of something. This is medication. Next one is initial treatment. Application of something. Something means name again. Name of the medicine. Name of something. Name of the medication. Name of the treatment. Name of what is applied. Applied powder, ointment, something like that. Name of the name of the thing. So that is it, right? So application of a hot pack, otherwise. Okay, what is the treatment? An ice pack, an ointment. Be careful. A cold pack, separate words. Okay, hot pack, separate. Okay, so check it out whether it is one word or two words. Okay, an ointment, very good, correct, an ointment. If you write it, so sometimes they will say okay without an, sometimes they will say not okay without an. So better write, na. Okay, better be positive. Sometimes if it is luck, you will get, otherwise you will lose this mark. Okay, right. Application of an ointment. Yes, cream. You can say cream. Then powder. Application of powder. Some powder. Then it may be some. What else? Cream, powder, application of gel. Yeah, very good. Okay, a cream. Okay, powder, no need a, it's collective noun. So fine, right? Very good. Next one. So application of different things you have given. Next one is dash briefly. Referrals. So whom will he be referred? So now this pain is there. Pain is sent to somebody. So because of this pain, a referral. So who is the professional here? So which medical professional? Name of the Name of the medical professional. Name of the medical professional. Name of the medical professional. So briefly he went there. What is the name of that medical professional? Okay, so dash. Okay, orthopedic surgeon, physiotherapist. Orthopedic is an adjective, not a noun. Orthopedic is not a noun, it's an adjective. So be careful. Physiotherapist. Okay, physiotherapist, right? Then what else? What else maybe? Physiotherapist. Then right, pain in the leg, maybe podiatrist. Maybe podiatrist also. Maybe podiatrist. Podiatrist. Maybe referral to another nurse, maybe, okay, or a home nurse or a community nurse. Okay, so here so briefly referred to somebody, briefly for some time. To whom? Which medical professional? Okay, pharmacologist. Okay, fine. A general practitioner, very good. Okay, yeah, referral for something also, maybe their acupuncture. Okay, fine. Right, next one. Now we are going to the 9th question. Question number 9. Okay, rheumatologist, very good. Question 9, rheumatologist, very good. Question number 9. We are moving to question number 9 now. Now, epidural injections, electric impulses. So this is the further treatment. What may be possible here? Two words. Intravenous injections, maybe. Okay, oral medications, maybe. So 2 words. Mostly there are 2 words. 9th one, you can write 2 words. So I have given you 2 words. So respiratory therapist. Okay. So that is further treatment. Initial treatment, further treatment. Okay. So what is the further treatment? So subcutaneous injection. Find subcutaneous injection with a hyphen or not. Just check. Intravenous medications. Okay. Check these words. Whatever you write, I'm not telling it is right or wrong. Check once again and be confirmed whether it is one word or not. Okay. You check in the Cambridge dictionary. For example, subcutaneous. Subcutaneous, one word or not. You just go to the Cambridge dictionary and it will help you. Okay. So intravenous. Intravenous. So intravenous is single word. One word, that is it. Intravenous is single word. Intravenous is single word. Then now let us see subcutaneous. 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 Yeah, it is one word. So be careful of writing these words. Okay. Right. So learn this. Be careful. Otherwise it will be a mistake then afterwards. Okay. Many people don't know and they'll lose their marks. If you do not know whether it is hyphenated, then how are you going to write in when you are writing in a case notes or okay, when you something is told, how you are going to understand? So this is fine. So what are the things I have given you? Intramuscular. Okay, fine. So all these things. Then oral medications. So I told oral medications. Oral medication. Then next, what else? What else? So then next one. Now let's move on. So this may be nouns, compound nouns. Compound nouns. 2 words will come here. You can see there, compound nouns. Compound nouns. 2 words will be there. So epidural injections. So this will be plural. Epidural injections. Electrical impulses. So singular or plural. It may be singular or plural. This may be either singular or plural. It may be singular or plural. No problem. Okay, fine. Next one. Decided not to try something. So this is also same thing. Same as above. Okay. Same. Okay. Similar fashion. Similar style. Similar style, you can see. Okay, not to try epidural injections, not to try electrical impulses, not to try oral medication, not to try intravenous injections, whatever it is. So patient attributes recovery to medication, recovery to something, it may be one word or two words, it may be singular or plural. Okay, the same thing with here also the same thing, similar. So you can guess what all the words which may be there. You can guess all. Sciatica probably related to something. Related to what? Related sciatica probably related to what? Related to overdose or maybe side effects. Related to what? Sciatica probably. Okay. Related to what? Okay. Relation to what? Regarding what? Concerning what? Okay. So find out similar style. Okay. Similar style. Okay, water. Similar style. Okay. Right. Simon sir is going to have breakfast in few minutes because after once we finish this one, we'll get a plate. Okay. So physiotherapy. Right. Now let us see here. Okay, very good. Try more things. Guess for all these 10, 11, and 12. Questions 10, 11, and 12. Or of the similar fashion 9, 10, 11, 12. 9, 10, 11, 12. All the questions similar style. Questions 9, 10, 11, and 12. Similar style. See whatever you want, you guess and type the words. Okay, fine. Very good. Very good. So now I'm going to play the audio. Yes. Very good. Serious students. I like you people. Okay. I like you students. Right. Now, I'm going to play the audio. Get ready. Take your notebook. Get ready. Take your notebook. Okay. Get ready. Take your notebook. Yes. Sensation. Okay. So this is secret, involves travel, manual work. These are the helping words. Application of dash. Okay. For relief. So pain relief. So application of dash for relief, pain relief. Okay. Then brief referral, short term, short time, that you can see there. Then not to try, not is a negative word, not try something. Recovery because of. Okay. Sciatica related to sciatica. Okay. Sciatica. So see here, sciatica developed. So that sciatica related to. So pain located in sciatica developed as a result of, that is what sciatica probably related to. Okay, sciatica is there and it is related to what? So all these things are important. So now we have activated vocabulary. Every day you do. Now from now onwards, whenever you go to part A, attack in the same style. Take some. First today. Tomorrow onwards you start doing directly. But today you take 3 or 4 part A's or take 10 part A's and do like this. First do everything, then go to the listening. Do everything, then go to the listening. Do everything, then go to the listening. Tomorrow don't do anything. Just do the listening. Directly. Take half an hour, no problem. Take half an hour, no problem. Take 1 hour, no problem. But today you do like this. Okay. The same things will be repeated. We'll be doing number of things today. Right. Okay. Get ready.
Occupational English Test. Sample Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to a new patient called Ray Sands. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come in. It's Mr. Sands, isn't it?
That's right, Ray Sands.
Now, I think you've been referred to me because you're suffering from sciatica.
That's right. Not for the first time, actually.
OK. Well, I've got some notes here, but perhaps you can tell me in your own words about any previous bouts of sciatica you've had, what treatment you had, what worked for you, anything else you can remember.
Righto. Well, it all started when I hurt my back, about 18 months ago now.
OK.
I was giving somebody a hand with a heavy suitcase and I felt it go, just like that. Anyway, I slowly got over that, despite occasional flare-ups, and then, out the blue, about a year ago, sciatica developed. And it was 6 months till that finally cleared up altogether. Now it's come back in the last month or so, I'd say.
I see. And your GP said it was sciatica?
Yeah, I had this pain all the way down my right leg, and she said the real problem was in my back because the sciatic nerve was getting trapped.
Right.
I mean, I'm telling you, this was no ordinary pain. It was really intense. I mean, to the extent that I couldn't stand for very long, couldn't walk hardly any distance, I couldn't sleep.
Oh.
I mean, the most frustrating bit for me was that I couldn't even turn over in bed. It just hurt so much. I just couldn't get comfortable. Do you know what I mean? Sometimes I'd have, a sort of tingling feeling in my calves as well.
Right.
But then at other times, my whole leg just felt a bit numb, really. It was weird. And of course, I couldn't go to work. I'm an events organiser, so I travel about a lot. I'm setting things up for conferences, lugging stuff around, And so there was no way I could manage any of that, the state I was in.
OK. So how was this treated?
Well, in the first instance, I was given painkillers, obviously. Ibuprofen, as far as I can remember.
Right.
And I was told to put compression packs on the affected area. I mean, that did ease the pain a little, but I was still housebound, practically speaking.
OK.
Then the GP sent me to see an osteopath, and I got some treatment there, but it didn't seem to make much difference.
Right.
So I was referred to a sports injury specialist, of all things. And he did a number of things that did seem to ease things a little, like working on my spine and lower legs. Oh, and he gave me a set of exercises to do at home.
I see. Any other treatment?
Oh, yeah, I almost forgot. There was this course of injections, and I went for various other therapies, like ultrasound, and another one where they do... they use, electrical impulses. I can't remember exactly what it's called.
OK.
At one point, I even considered acupuncture, but by then, the other things were beginning to take effect, and the symptoms were subsiding, so I gave it a miss.
So, which of these various treatments do you feel was most effective? What made the difference?
Well, I couldn't say for certain because it all went on for 4 months without much improvement, really. Then it wasn't until suddenly in the 5th month things changed quite dramatically. So to be honest with you, I think it was the combination of treatments gradually taking effect and coming together rather than one single thing making the difference.
OK. And did anyone ever talk to you about what might be causing the problem?
Well, I think everyone assumed that a slipped disc was behind it all, but
Right.
was never actually confirmed as that. I mean, I know there is this other condition where you get a lot of pain in the buttocks, but that wasn't my experience.
OK. And did anyone talk to you about aspects of your lifestyle that might be contributing to the problem?
Well, I remember actually there was one of the therapists.
Yes, be ready. Okay.
Extract 2, questions 13 to 24. You hear a consultant dermatologist talking to a patient called Jake Venn.
Okay. Now we come to the questions. Okay. We come to the questions now. Right. So now let us check the audio. Yeah. Now we are going to check our answers. And be careful of capital letters if you are writing, okay? I will tell you now straight if it is capital letter or not. If you put capital letter unnecessarily, you will be losing your unnecessary hyphen. Everything I'll show you. And I'll tell you whether your answer is right or wrong also. So be careful. And when you are submitting your answers, submit in a reasonable fashion. Okay, be careful when you are typing. Now what you do is question number, checking our answers. Question number 1, type and keep it. Don't submit until I tell you. Question 001. Don't submit until I tell you. Only when I tell you submit your answer, you submit the answer. Yes, Anisha. Hello. You can unmute. Or you can message me personally on WhatsApp. You can either unmute or you can message me on WhatsApp. Your wish. Okay. Yeah, we are going to discuss afterwards. Right. Okay, sorry. So fine. Right. So now, now let us see question number 1. Okay. It's not mistakenly, it is mistakenly. Okay, right. Okay, fine. Now let us see our styles, how we are going to use them. Question number 1. Now, 7, 6, 5, 4, 3, 2, 1. Submit your answer. Usha, wait until I tell you submit. Okay, please. Right. Fine. Now you all have submitted your answer. Now let us check the answer. Okay. This is the question paper. Okay. File. Open. Okay. Answer key. Yeah. Okay, be ready. Now the first answer is coming the way. First answer is coming in the way. Okay, now check your answer. And in your notebook, you put a tick mark. If it is wrong, correct it. Because these words will definitely come in, at least one word will come in the exam. Definitely, one word will come. That means if you are doing 10 tests from 10 words, one word will definitely come from 10 tests. That means you'll get 10 answers. That's how. So first one is here. Yeah, here is the first answer. A heavy suitcase. A heavy suitcase. That is the first answer. A heavy suitcase. Answer number 1. A heavy suitcase. If you write A or do not write A, now let me check and tell you. Usha. Answer is right. Mosase. Answer is right. Prashanti. If I say answer is right, then only you put tick mark. Otherwise, no way. A heavy suitcase, right. Rajalakshmi, suitcase, right. Diana, heavy suitcase, right. Jyoti, a heavy suitcase, right. Anisha, a heavy suitcase, right. Reena, a heavy suitcase, right. See, now if you write A or no, no problem. Heavy, no, no problem. Or only case or suitcase, no problem. So, suitcase is a must and case is also a must. Any one. Heavy you write or no, no problem. A you write or no, no problem. Because here they have given brackets. Sometimes they will not give brackets. Sometimes they will give bracket. So based on that one, you will get your score. So be very careful. Better to write. Better to write. If you write, no loss of mark. But if you do not write, there may be 50-50 chance to lose the mark. That's what I'm telling you. Now next, let us go to second question. Okay. Question, write and keep it. Don't submit until I tell you. All of you should submit at a time. At a time. Question 002. Because I don't want anybody to influence anybody. Everyone should come at a stretch. Okay. 7, 6, 5, 4, 3, 2, 1, and submit. Okay. Yes, now the second answer is going to be revealed. Opens a same. His right leg or the right leg. Okay. Down is not necessary. Musa said down is not necessary. Because pain located in is already there. In is already there. So down, pain one preposition is already there. So no need of another preposition. That is the mistake you have done. You lost this mark, Musa said. D Musa said. You lost this mark. So be careful. So next one. The right leg right. Down the right leg wrong. Then next one, Diana right. Anisha right. Usha right. Then Anisha right, Usha right, Reena right, Prashanti right. Next we'll move to the third question. Pain described as, question number 3. Get ready. Question 003. Fine. Pain described as. Okay. 7, 6, 5, 4, 3, 2, 1, and submit. Okay, now let us see the answer. Yes, really intense. Okay, really intense. So Musase, you are right. Jyoti right, Anisha right, Prashanti right, Usha right, Diana right. Okay, yes, that's okay. That's okay. Intense is the most important word that is there. That's okay. You'll get the mark because very is related to really or extremely. That's not a problem. Okay. Really intense means extremely intense or very intense. Okay. You have given the synonym, but okay, fine. Try to write the word as it is. So listen very carefully. If you don't listen, then don't write. What is there in the text, as you listen, you have to write. You did not hear very, so you should not write. That is the point. So, okay, you will get this mark. But if Simon sir is going to correct this paper, you will lose this mark, Diana. If Simon sir is correcting this paper, don't expect Simon sir to be there. If your Simon sir is there, you will lose this mark because that is not given in the answer sheet. So you cannot write that one. So you lost this mark practically. Okay. So be very careful. What you hear, that only you have to write. You cannot imagine. No imagination. Imagination. No imagination. You cannot imagine. What you listen, that is important. Solid information. Solid information. Solid information. That is needed. Be careful. Solid information. So next, question number 4. So let us take question number 4. Yes, 7, 6, 5, 4, 3, 2, 1, and submit. Submit your answer. Okay, right. Now we are moving to the answer. How many students are there? 8 students. 1, 2, 3, 4, 5 students only answered. Let me check who did not answer. Usha answered. Prashanti answered. Masase. Then Diana. Jyoti. Rajalakshmi, you did not. Okay. Then next, who is there? Right. 1, 2, 3, 4, 5. Prashanti, Usha, Jyoti, Demusase, and Anisha. Okay. Okay, fine. Right. Try to write the answers, all of you, please. Then next one. We are moving. So, there are 2 answers here. Turn over in bed. Turn over in bed or get comfortable. 2 answers are there. Anyone you can write. Usha, right? Prashanti, right? Mosase, right? Diana, right? Jyoti, right? Okay, right, no problem. That is not a problem. That's okay. The bed, turn over in bed, right? So you need not write also, no problem. Diana, what happened? Turn over. Yeah, you are wrong. Diana, you are wrong. Turn over in bed. Okay. Turn over may be any place. So turn over in bed. Very good. You have identified. I'm sorry. Okay. Turn over in bed. Wrong. Yeah. So next. Question number 5. Question 5. Question number 5. Question number 5. Dash sensation. 7, 6, 5, 4, 3, 2, 1. Submit. Rajalakshmi is at work. Yeah. Fine. So let us check the answer. Tingling. That is the answer. You are right. That is the right answer. Tingling is the right answer. Very good. All of you correct. Next question number 6. Question number 6. 7, 6, 5, 4, 3, 2, 1 and submit. Right. Okay, fine. Question number 6. Sorry. Yes. Question number 6 is there. Events organizer. Events organizer. Okay. Fine. So events organizer. Right. So SER, ZER, both are correct. S is R, Z is correct. So you have two spellings. OR, yeah, Usha, you are wrong, of course. Okay, OR, GANI, ZER, or OR, GANI, SER, both are correct. It is events organizer. It is very clearly heard. Events organizer. He told very clearly. He told very clearly. Okay. Okay. Room temperature is one singular. Room temperature we say. We talk about any particular room. But here is not one event, but he organizes events. So events organizer. So it's plural here. It's plural. When you say room temperature, it's room singular. But events organizer, it doesn't a single organizer, but he organizes many events. So events organizer. Okay. Right. Fine. Many people say it is okay, okay, okay. Don't think that. Don't take things easily. Okay. You have to listen very carefully. That's what I'm telling you. Okay. Next question. Many people lose. This is the reason why. Question 007. Question 007. 7, 6, 5, 4, 3, 2, 1. Submit. It's plural, compression packs. It's plural, compression packs. It's plural, compression packs. Now let us see very clearly, how do we know that this is, why this is right? It's very plural. He did not say compression pack. Otherwise, he will say a compression pack and yes in brackets. So, he will put yes in like this, in brackets, like this brackets he will put. Otherwise, A he will put here. He did not put anything here. He clearly said compression packs. That means it is plural. How do we know that it is plural? I'll show you the case. Okay. Open audio script. It's very clearly spoken. Yeah. I was told to put compression packs on the affected area. If you cannot understand whether it is singular or plural, it is difficult. So that is it. How can you miss this as I don't understand? He did not say A. There are many different ways how to identify this. There are many. Anisha, remember this. This is what you told. I miss S. Anisha, do you remember? Unmute, please.
Yes, sir, I remember.
Now you understand. Now you understand why, okay, people lose this. Have you answered this question? Your answer is not here. Did you submit your answer here? Anisha?
Sir, can you please check your WhatsApp? Yeah, I write the answer, compression pack.
Okay. Fine. No problem. No, here I did not. Okay, fine. So, okay, fine, sorry. Okay then, no problem. So, now let us see here what I am telling you. So, Adari Prashanti answer is wrong. Usha answer is wrong. Diana Shiba answer is correct. Jyoti Thomas answer is wrong. Mosase answer is wrong. Only one person, Diana Shiba, answer is right. Only one person, answer is right. Oh, inverter also giving problem now. Okay, fine. So now this is how it is. So now Anisha told me, sir, I have problem in identifying whether singular or plural. That is what she discussed. Okay, that is what she discussed. Now try to understand the importance of this thing. How many students wrote the answer here? 1, D. Mosase, 2, Jyoti, 3, Diana, 4, Usha, 5, Prashanti. So 5 students wrote this. Okay. And out of 5 students, only 1 student got the correct answer. So that means this is the difficult level of question. That means you are not able to digest whether it is singular or plural. You are not able to digest whether it is singular or plural. The question is testing you whether this is singular or plural. Who wants a compression pack or compression pack? Nobody wants that. Question is focusing on. What is the question focusing on? Question is focusing on what? The question is focusing on your ability to identify singular or plural form. So which form? It is asking you to identify singular or plural. Here, there are many students who have written, compression pack. Be very careful. Sorry. Compression pack. So this has no reference. It should be either singular or it should. This is totally wrong. This is absolute nonsense. You can never write compression pack. You have to write either singular or plural. That's all. You can write either singular or plural. You can write either singular or plural. You see, S is there. This is compression pack is wrong. It is totally wrong answer. It is meaningless because this is a countable pack. Pack is a noun. A pack is a singular and packs plural. So this is a countable noun. This is a countable noun. Don't you know that it is countable or uncountable? Who wants your answer? Nobody wants your answer, please. Nobody wants your answer. They are testing something else. Reading between the lines, pack. Now, pack is transitive or intransitive verb. Okay, but this is not verb, this is noun. We want noun. This is verb, we don't want verb. Verb, no, we don't want verb, we want noun. Go down, go down. Here it is noun. Noun, it is saying countable. Countable means you can count 1 pack, 2 packs, 3 packs, 4 packs, 5 packs. Furniture, uncountable. Furniture, uncountable. Uncountable. You cannot count 1 furniture, 2 furnitures, 3 furnitures, 4. It is rubbish. Furniture is furniture. That's all. There is no A. There is no furnitures. No A and no S. Now you understand what is countable and uncountable. I told you I am taking you to a depth of the level. I am taking you to a serious depth of the level. This depends on countable. For example, there is no singular and plural. No singular, plural concept. For uncountable nouns, it is just one form. Air, A-I-R, air, water, furniture. So uncountable, you cannot say 1 water, 2 water, 3 water. 1 bottle of water, 2 bottles of water, 3 bottles of water. No problem. 1 piece of furniture. So furniture, water, air. No. So here you cannot, this is not countable or uncountable. Now here you should know what is countable noun and what is uncountable noun. What is countable noun and what is countable noun? So now this pack is countable. You don't know the difference. That is the problem here. You don't even have an idea about that one. What he is asking you here. You don't have an idea. Even if you just realize, you can write there. And affected area only 1 day, only 1 pack all through the time. You will change and you will replace another pack, another pack, another pack, another pack. Only 1 pack always. So it is countable. You change every often, every day. Okay. So that is plural, pack. Now you understood what is countable and what is uncountable. Furniture is uncountable. And pack is countable. Pack is countable. See here. Pack is countable. Pack is a noun. Pack noun is a countable. It is countable. See here, countable. It is countable. What do you mean by countable? Okay. Countable. So if you go there, see, countable noun. Countable noun has a plural form. I told you, countable noun has a plural form. Uncountable or singular noun, a noun that has no plural. Singular noun and uncountable noun, okay, it's just singular, that's all, no plural form. Okay. Uncountable. Try to understand, you cannot count uncountable noun, it doesn't have a plural form. So don't you realize that? So these are kinds of nouns: countable noun, uncountable noun, singular noun, plural noun, noun plural, usually plural. Some nouns are always usually plural. For example, arms, measles, mumps. So they are always plural. Some nouns are always singular, like furniture. It's uncount noun. So don't you know, you don't know this grammar concept. I'm showing you here. Learn what is this you. What is that you? Learn what is that you. You don't know. So count, back, countable. Okay, it is countable. It is not uncountable. That means a singular will be there, plural will be there. So you are supposed to write either a singular or a plural. That means your answer should be a compression pack. You have the choices should be a compression pack. This is singular. Or you can say compression packs. There are two choices you have, but the choice which you used is totally wrong. Compression packs, that is plural. So these are the two options. You can write this too, but why did you write compression pack? It is totally wrong, blatant mistake, outright mistake. It is not even singular, it is not even plural, it is not a correct answer or choice at all, first of all. Totally wrong. Okay? Without A, how can you write pack? So you can write, so this is a noun, pack is a noun which is countable. So compulsory, it should be either singular or plural. Either singular or plural. Okay, you can write either singular or plural, but there is no singular, no plural. Many students wrote like this, compression pack. Many students wrote like this one. There is no singular here, there is no plural. By default, it is wrong. How do you want OET to give you mark for this? And the answer is not, okay, a compression pack. If you write, the answer is wrong. Because he clearly told it is compression packs. Compression packs. This is the correct answer. Okay, this is the correct answer. Why correct answer? So you have two chances here, two options. There is no, the speaker did not say A or A compression pack. A, you did not listen. You did not hear A. He did not speak A, so you did not hear A. Number two, he spoke S, packs, 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 sa sound, compression packs. So first one is, there are two options how to find out this answer. Anisha, so this is what you asked, two chances. If you missed it because two chances. First one is no A, no A. A is missing. No A. So A is missing. A is missing. So, sorry. A is missing. A is missing. Number one. So the sound A or a compression pack or a compression pack, a compression pack or a compression pack, a compression pack, a compression pack, a compression pack, or a compression pack, a compression pack or a compression. Both the sounds are missing. A and A. Both sounds are there. A sound is there or A sound. A compression pack or a compression pack or a compression pack. So missing. So missing of a article. Okay. If singular article a or an must be there. And here you know that a is not there. Number one, that is the rule that you know that it is plural now. And presence of S. Presence of S, sound. I'm talking about sounds. I'm not talking about the letters. About presence of, okay, S. I am talking about sounds. I'm talking about sounds here. A sound is missing and S sound is present. If you notice that A sound is missing, you will know that it is plural. If you notice that S sound is there, then also you will know it is plural. There are two chances. But how still everyone lost it? Because you are not bothering about singular or plural. You are not bothering about singular or plural. So bother about singular or plural, bother about countable or uncountable, bothering about sounds, all these things. Very important. Take care. Okay. Take care. Next one. Question number. Okay. Next one is question number 008. Question number 008. Okay. Yes, question number 8. Okay. Question number 8. 7, 6, 5, 4, 3, 2, 1, and submit. I'm teaching you rules. Come on, others. Question number 8. If you are not interested to write the answer, I will leave it. No problem. I'll close the session. Submit your answers, please. Okay. Now let us see the answer. Yes. Now this is the answer. Usha, answer is wrong. Answer is wrong. Answer is wrong. Because this is punctuation problem. Punctuation problem. It is small letter, not capital letter. How can you write a common noun in capitals? How can you write capital letter? You are not supposed to write capital letter. So sports injury specialist. Sports injury specialist is already there. The next one, sports injury specialist. Before that only it is osteopath. Demosase. Okay, you missed the answer actually. Mosa say you missed the answer. You lost the answer itself. You are not ready. You lost the answer. Sports injury specialist is the next one. Already there it is. The answer is given there. And you did not even realize that one, that the answer is already gone. Okay, right. Diana Shiba, right? Okay. Here, sorry. Here, Anne is compulsory. If you don't write, no problem here for this test. But in some tests, they will not give brackets. Then what happens? Okay, whatever he told, listen to it very carefully. Whenever a noun is coming, listen to it before. Okay, listen to it before to see an osteopath. An osteopath. See, singular or plural, it is also a osteopath is a collective, sorry, is a countable noun. One osteopath, two osteopaths, three osteopaths, like doctors, one doctor, two doctors, three doctors. So it is a countable noun. Okay, so be careful. Then next one. Fine. So you got it. Next question number. Question number 9. Question 9. Question number 9. 7, 6, 5, 4, 3, 2, 1, and submit. Submit your answer. Come on, all of you. Submit, all of you. Yes. Submit, all of you. Yeah. What about the others? What about the others? Yes, Jyoti, good correction. Very good. Then next one. Okay. Now let us check the answer. Yeah. Ultrasound is name of an thing. That's all. Ultrasound. Sound. Why do you want to write an? Why do you want to write an? Sound. You don't understand what is sound. Sound is uncountable or countable here. Ultrasound. Okay. Test is okay. Now let us see. Sound in general. Sound can be singular or plural. Okay. Can be singular or plural. Right. It's just see here before for the previous questions. There is some option here. Epidural injections. Electrical impulses. They are plural. Okay, fine. So you can take this one not as singular. Okay. Ultrasound, that's all. Ultrasound, enough. Okay, now let us see here. Let us check if it is, if you heard ultrasound there. Okay. Yeah, see here. Ultrasound, that's all. Where did you hear an? Just ultrasound. Just ultrasound. Therapies like ultrasound. Ultrasound therapy. Ultrasound therapy. Okay. So ultrasound, that's enough. So next question. So you can just write ultrasound. Okay. Be careful. That's why listen very carefully. Before and after, you lose the mark. You lose the mark. Nobody got the correct answer here. You think that you will get this mark? Huh? You don't know what is singular. You don't know what is plural. You can't identify whether he has spoken an or not. An ultrasound. An ultrasound, an ultrasound, an ultrasound, an ultrasound, an ultrasound. It's very easy to identify the sound. How did you imagine this sound? Where did this sound come from? From the air? From the sky? From the heavens? Listen very carefully. Listen very carefully. Listen to very carefully. What is there is important. Don't imagine things. What is there is important. Never, ever imagine. Never, ever imagine. Never, ever imagine. Okay? That's the point. You lost, all of you lost the mark. All of you lost the mark. This is the reason why people lose the mark. Okay? Right. The next one is, I told you this is a very deeper level, one short lecture. This is not three-phase lectures. This is a one short lecture. Okay. Many people were asking me, your lectures are long. I know. Now you understand why the lectures are long. Because I want you to get the correct answer. I want you to get the correct answer. Next one. Okay. See, I don't even bother. My breakfast is waiting. I don't bother. I want you to get good results. That is what is important. Right. Next one. Question number 10. Question 10. 010. Question number 10. Question number 10. 7, 6, 5, 4, 3, 2, 1, and submit. Now you started thinking. Start thinking. Countable nouns, uncountable nouns, singular number, plural number. Come on, come on, come on, come on. Write, write, write. Write down. Write down. I want active people. I don't want inactive people. 1, 2, 3, 4 students. Okay, still 3 more are left. Okay. Right. Yes, that is okay. That is the answer. Acupuncture. Usha, spelling mistake. This is a very specialized medical term. How don't you know the spelling of this? That is the point. You have to learn the spelling. Write 10 times. Write 10 times. Okay? You are supposed to learn. What if this comes in the examination? In writing or listening or reading? What will you do? Write 10 times. And send it to me, Usha. I want to see what all mistakes you have written. 10 times learn. Because I don't want you to lose this mark in the exam if it comes. Next. Only regular students will be there here. I will not invite everyone. Jyoti, spelling mistake. How do you not know the spelling? Diana, how do you not know the spelling? Mosase, good. Prashanti, good. Right. Okay, fine. Rajalakshmi, good. Next one, 11th question. Only 2 more. Last 2 questions. Last 2 questions. 11th question. There are many people who don't want to attend long sessions. Let them not attend. Let them not attend. You are attending and you will go faster than them. Tortoise, tortoise. Okay, tortoise is slow. Tortoise, we are tortoises. We are slow. We are lengthy, but we are the winners. The hares who run fast will never win. Let them suffer. No problem for us. Okay. So that is I'll show you something. Today morning I have noticed this one. When I typed there, insert, when I typed race, okay, When I typed images, then I just typed race. I got a wonderful image. I was really shocked. Today we are doing the race. Okay. So, where is that? Running. Where is that? Yeah, here it is. See here, I got a wonderful image. We are tortoises. Let us be tortoises. We are slow in learning, but fast in results. We are slow in learning, but fast in results. That's okay. That's absolutely okay for me. That's absolutely okay for me. We take time to learn. We take time to learn, but in the race we'll be the first. Okay, those who are writing 3 times, 4 times, 5 times, they'll not get the results because they don't learn. They don't have time to learn. So why should we suffer for them? Let them suffer because they don't want to learn. Okay, do not play with OET. Learn. People who want to enjoy like hair, okay, they will rest and sleep. Let them enjoy. They have a lot of things to do. We have only one goal, learn. We have 7 days left. 7 days, we will learn and only learn. That's it. So I have shown you that one, right? Okay. Fine. So next test, you see the result, how much difference will be there. Okay, it's very, very essential for you to know this. Practice makes a man perfect. Laziness, slumber, SLUMBR, slumber, sleep. These are for lazy people, not for winners. Okay, right. Yeah, question number 11. 7, 6, 5, 4, 3, 2, 1, and submit. Usha, how can you combine one treatment? Okay, if 2 or 3 are there, then only you can combine. No, Usha, you have got the answer, but why don't you you have a lot of common sense, Usha. You are very clever, you are a nurse and you are working for a very famous organization. You have studied too much. Don't you know that only one thing cannot be combined? Then you need 2 things at least to join, to combine. So it should be plural. It should be plural. Do you understand, Usha? Yes. You have to understand that. Okay, fine. Okay, you have a lot of common sense. Apply that common sense. Combination of treatments. Very good. Combination of treatments. Very good. Very good. Excellent. Usha, you lost this mark. I'm sorry. You lost this mark. Absolutely lost this mark. Don't think you will get this mark. So question number, many people are angry. Sir, you are telling nobody is teaching like this. Why are you teaching all these things? Everyone is saying it's okay in spellings. It's okay in spelling. Oh, this simple logic, if you don't know, how do you know English? How can people realize that you know English? Okay. Do you think OET is playing the fool with you? No. Don't play the fool with OET. It's a matter of 30,000 rupees. This is not just your money. Your family is also sacrificing your presence. Okay. Question number 12. Yes, question number 12. 7, 6, 5, 4, 3, 2, 1, and submit. Okay. So 1, 2, 3, 4. What about the others? Last question. Come on. Yeah, finished. Okay. Now let us go to the last question. Where is the article? Is it singular or plural? Is it singular or plural? Okay, right. Or is it definite article? And what is the spelling of disc? CRK. So CRK, disc. So remember. So learn the spelling. Okay. Floppy disk is different. This disk is different. This is medical disk. Okay. Medical disk. See the spelling here. Slipped disk or herniated disk. Okay. Slipped. Slipped. Okay. Usha. K, no, C. Then Musase. Usha. K, no, C. Okay. So now total score. Spelling is also important. Out of 12. Come on, submit your scores, please, fast. Submit your scores fast. Submit your scores fast. Okay, so now I am opening your mics. Anisha, first starting with you with A. I am opening everyone's mics. Yeah, Anisha. Chair తీసుకున్నా ఇది తీసుకొని కూర్చో. You can unmute all of you. Anisha, okay, Diana. Okay, Musase. D. Musase from which name, which country? Lesotho, right?
Yes, sir.
Hello, darling. How are you?
I'm fine, thank you.
From South Africa.
Yes, South Africa and Lesotho.
Yeah, how do you have registered only for writing, but you enjoy listening, right?
Yes, sir.
How is that? How are the sessions?
The session is good, sir.
Yeah, the one Selamanga who referred you, right?
Yes, Russellman.
She referred another doctor yesterday.
Okay, I'll refer the other one, me too.
Okay,
Yes.
fine. Right. So let us see here. What did you learn today? Tell me, what's the name? Musase.
Yes, Musasi.
Yeah, tell me, what did you learn?
I learned that I have to focus, really focus on my spelling and the plural and the singular.
Okay, was that useful or was that a waste of time?
Yeah. Yeah, I may say so.
Yeah, fine. Next, Diana, Jyoti.
Good afternoon, sir.
Good afternoon, Jyoti. How are you?
Fine, sir. I got 10 out of 4.
Where are you now?
Yeah, fine, sir. I'm in Saudi Arabia, sir.
You are in Saudi Arabia?
Yeah.
Yeah, tell me, how did you feel regarding the session?
Sir, it was really useful. Actually, I have written all the answers, but now I understood due to this article issue, I will lose the mark. Ultrasound and this compression packs. Actually, I wrote this article issue. I made this article issue. That's the reason I lost this 2 mark.
Okay. So was the session useful or not?
Yes, sir. It's
Okay,
useful. I will
fine.
follow.
Next, Usha. K. Usha from Bangalore.
Yes, sir.
Yeah, Usha. Very strong voice. Come on. Yeah, tell me.
Yes, I lose because of silly mistakes.
Yeah. So that means you should not do silly mistakes. That is the meaning, right?
Yes, sir.
That means you have to be careful, right?
Yes, sir.
That means you have to apply all the techniques, right?
Yes, sir.
That means you have to follow the style which I am telling you, right?
Yes, sir.
That means the session is not useful, right?
It's useful, sir.
I thought you will say yes, sir. Okay, okay, right. In the flow. Every time, yes, sir, yes, sir, yes, sir. Last also you should say yes, sir. Okay, fine. So, right, there are more sessions to come. Okay, and in the
Okay,
afternoon we
sir.
are going to do the reading session. Okay, fine.
Okay, sir.
Prashanti Adari.
Sir, can I ask something?
Yeah, definitely, please.
Yeah, actually, 7 days are remaining for the exam. How to do more practice and how to score more marks? Can you
Yeah,
give
that is
us a
what I'm
tip?
telling you. No, do lesser tests and do systematically like this. Doing 100 tests will not help you. Do 6 tests only, but do
Okay.
systematically. Okay.
Yes, because I feel that all the strategies are weak for me.
Okay,
I
fine.
don't
No
know how
problem.
to
No
score.
problem. Yeah, I already gave you the solution. Do less tests and practice more. Okay. Don't do more tests and practice less. Okay.
Okay, sir.
Okay, fine. Prashanti.
Yes, sir.
Yeah, Prashanti, where are you from?
From Saudi, sir.
Saudi Arabia. Okay. Prashanti, share your experience.
Really gain lot of knowledge. These we can use during the exam. I think it will be really helpful.
Okay, was the session useful or was it a waste of time?
Useful, sir. Even though it is slowly, but it's very useful for us.
Yeah, there is a saying, quotation called slow and steady wins the race.
Yeah. Yes, sir.
Slow and steady wins the race. Instead of doing all nonsense things, 100 things, do one thing perfectly, no?
Yes, sir. Yes, sir.
Correct or not?
Correct only, sir.
So that is it. Next, Rajya Lakshmi. Okay, Anisha. Okay, fine. Right. So write 1 or 2 sentences, maximum 3 sentences. Your feedback. Okay. And I'm giving you just 2 minutes and I will close the session. So feedback, please. The mics are muted. So just 2 minutes I'm giving you. The mics are muted. Yes, I am closing the session now. I am closing the session.